if you...
I'm sorry, madam.
Thank you so much. Thank you.
But I'm on that fasting, no? So
I know.
after I finish, once I reach home, uh, then I want to go to sleep types. It's like that. Anyways, tell me. Start. We are on YouTube. Yeah.
Yeah. So good evening, everyone. I welcome all of you to this very exciting session on how to set up IUI Lab. So this topic has been requested by a lot of people, and I believe this will add a lot of value, if at all, if you already have an existing IUI setup, or if you are going to start a new IUI setup. I think this is the need of the hour with so many rules and regulations coming in. And also to optimize your results, what is the best practical points that you need to know with regard to the IUI lab? Dr. Jay will tell us today. Over to you, sir.
Yeah. So friends, actually, I am sitting inside my small IUI laboratory. Okay. And one of the most important words which you should keep in mind here is small. Okay. And even if you have a restriction for space, the laminar airflow, which is standardly going to suffice for an IUI laboratory, will be either a 2 feet by 2 feet one or a 4 feet by 2 feet one. Okay. You don't need a laminar airflow higher than that. That is just one thing which you need to keep in mind. I will just try to switch the position and I will show you. This is exactly how the laminar airflow looks like. I'm sure all of you can see because I have spotlighted my video. Okay. This is the entire laminar airflow, which is 2 feet by 2 feet. It has a stereo zoom microscope. It has a heating block, which is present here in order to heat the tubes. The heating block has a temperature guide. Okay, we have a fan on, fan off button here, which is absolutely standardized, and we have the fan pressure, okay, with which the air will be pushed through this laminar airflow. So this laminar airflow is actually something which is very, very easy to create. You can even build it in your own home. Okay, it has something called as a HEPA filter inside. HEPA basically, stands for highly efficient particle aggregator, HEPA. Okay, it is that type of a filter which is present inside this. So inside this you have the HEPA filter. Okay, and what the HEPA filter is going to do is that it is going to collect all the particulate air from outside, and it is going to try and push this air inside. Okay, so the word laminar actually stands for putting a straight airflow. The word laminar means the air is going to flow in a laminar direction, in a straight direction, and it is going to ensure that all the particulate matter and the waste are not accumulated onto the surface, okay, of this airflow chamber. Obviously, this is one standard design. Mine IUI laboratory is almost an 8-year-old laboratory. So this is a standard design of an 8-year-old laboratory. Some new things, electronic, digital, would have come into existence by now. And I'm sure all of you can get used to those particular type of things which are new inside this entire thing for your own benefit. Okay, but then that is something which is very important. I'm sure as far as the licensing requirement is concerned, a lot of people are confused between taking a level 1 license or a level 2 license. So obviously, somebody who really wants to process sperms, free sperms, and all these things, then it is better to apply for a level 2 license rather than a level 1 license. Okay. I also wanted to show you another absolutely important thing, and see, it is that, okay, this is my Hera W9 ultrasound machine, which is just adjacent to the IUI room. Okay, and this is a ultrasound which ultrasound purposes, absolutely essential requirement for anybody to do a good eye practice. Okay, you can't really have IUI practice without an ultrasound machine. So keep that in your head, irrespective of the type of ultrasound machine which you use. Okay, you can use whichever ultrasound machine that you want to use, but try to have a good ultrasound machine so that it helps you in optimizing your results better. I also understand that when you do this entire thing, the ultrasound is not going to be a very profit making initiative for most of you. Okay, it is not going to be a very high turnover, high profit making initiative, but it is important for people to understand that it is absolutely mandatory for you to go and invest in a good ultrasound unit. Okay, fine. Apart from this, I think what is extremely important that people should keep in mind as far as this entire procedure is concerned is that you must always learn to invest in good quality of cold storage units. Okay. Try and invest in good cold storage units, because a good cold storage unit is again absolutely mandatory for you to have a good temperature sensitive control of your drugs. And once you have a good temperature control of your drugs, your life in an IUI is any which way is going to become much more easier. All right, fine. Now, after having studied this many things, it is important for everyone to understand as to where do we procure these drugs from. Okay, how are we going to go about the setting up of the IUI laboratory, and on an average, how much time it would take. So please understand, it is absolutely standardized. If you are a very busy IUI unit, or if you are a fresh IUI unit, you are going to order for almost all the disposables, almost all the media, and all the consumables from a particular vendor. And remember, most of the media which is commercially available is extremely good for performing IUIs. So there is no inhibition in that. There is no problem in that. All right, you can easily do that. It is also important that when you do IUI in your own setup, you have absolutely realistic expectations about the outcome of this procedure. On an average, your IUI success rate will be approximately 12 to 14%. You are not going to be able to cross a success rate of 12 to 14% when you are doing an IUI. So please keep that in mind. Okay. Another important thing, which I think is very, very important, and people must understand it absolutely categorically as far as IUI is concerned, is that when you do IUIs, you have to ensure that all the documentation regarding the PCPNDT, which is generated by your local ward officer, is taken care of, and everything is put in order by one of your staff. Okay, you have to do that. There is no escaping that thing when you set up an IUI laboratory. All right. And finally, when you are doing a good IUI cycle, remember, automatically you are going to generate a lot of work as far as obstetrics and endoscopy is concerned, because IUI is a common procedure which has a wide variety of indications, and a lot of couples are going to be eligible to do IUIs. Okay, so keep that in mind. The only problem which I commonly foresee with people is people try to mug up the protocols in IUI, and then they try to apply those type of protocols in their routine practice, which ultimately doesn't help them, or which doesn't benefit them in any manner. Okay. Anything else, if anybody wishes to ask regarding IUI, I would be happy to answer. I also want to tell you that the routine technique which we use is a swim up technique. The routine catheters which we use in IUIs at our place are embryo transfer catheters, but people can use soft IUI catheters as well, commonly available in the market. No need to worry about that. We have an in-house cold unit. Okay, we have an in-house cold room out here. Okay, the reason why we have an in-house cold room is because this is a very, very busy IVF unit. So we require an in-house cold room. But people who don't have that, it is better to have a temperature calibrated 2 to 8 degrees Celsius refrigeration facility which is available in your premises. If in case you think that you are a premises where there is going to be some problems as far as the UPS, as far as the electricity is concerned and power outages are concerned, you must ensure that all your IUI machines, including ultrasound machines, are connected to an online UPS system, and that will generate some uninterrupted power supply for you with a backup, with a linear power, even if in case of an outage, and it will increase the longevity of all your instruments and all your machines. Okay. So with this, I basically finish a routine setup of an IUI laboratory. This is not going to cost you more than 10 lakh rupees. 10 lakh rupees is on a higher side, and I wanted to mention this number. The highest budget which you require is 10 lakh rupees. You require one incubator. This incubator doesn't exceed 3 lakh rupees. You require a laminar airflow 4x2, doesn't exceed approximately 3 lakh rupees. So that is 6 lakh rupees. And I'm talking of another 4 lakh rupees for your disposables and your media. Okay. The ultrasound is completely your choice. See, ultrasound machines will go from second-hand machines, which will go from 10 lakh rupees, to a higher-end machine, which will go to 65, 80 lakh rupees. Okay. So now it is up to you which type of ultrasound machine that you want to invest in. Okay. But investing in an ultrasound machine is absolutely mandatory. And I believe, okay, IUI is something which has to be practiced by each and every gynecologist. because the future of practice as an obstetrician and gynecologist is not going to be obstetrics alone. It is going to be obstetrics with basic fertility. And when you are covering basic fertility, IUI is something which you have to, okay, which you have to specialize in, as a lot of your patients are going to require this therapy. Okay. So with this, I finish and I will be open to answering questions from Dr. Shilpa.
So see, for the basic IUI lab, we need LAF, as you told, we need a heating block, we need a microscope, and we need a centrifuge machine.
Yeah.
So centrifuge, you use the same Remy centrifuge?
Many are available, madam. I have 6 centrifuge machines because I am having an in-house pathology as well. Anyone you can use, absolutely any good centrifuge machine can be used. There is no such thing.
Okay, you use the stereosome microscope, which is on the, I think, on the advanced side of the microscope. So even the phase contrast microscope will also be sufficient for an IUI workup, right?
Definitely. For an IUI, even phase contrast is sufficient, but the cost difference between stereozoom and phase contrast is not very high. So when you are buying your laminar airflow, I think the cost difference comes to around 20,000 rupees, and that 20,000 rupees extra has to be invested because a stereozoom offers you much more wider range of applications. Okay.
So Makeler chamber, you didn't mention. Do you have the chamber with you? Can you just show it, please?
Yeah, I have the Makeler chamber. I'll show it. It is not mandatory to invest in a Makeler chamber because I have a CASA as well. And that is the reason why I did not show the Makeler chamber. But I will again go to the IUI laboratory and show it because it is something which is very standard. And a Makeler chamber is something which people must otherwise have if in case you don't have a CASA. So this is the Makeler chamber. Okay. And this is good for your pre-wash and post-wash counts for almost all the patients who are undergoing IUI. Okay.
Yeah. So the Makeler chamber is Indian made and also imported. So you think
Yeah,
the made is good enough for 60,000 rupees, or we should?
everything is good. Everything is good. No problem.
Thanks. So the clean room, I mean, for the andrology room, I mean, do you maintain very strict asepsis or clean room, or even just a flooring? I mean, are you specific about the flooring in the IUI processing room?
Though it is a recommendation, it is not a mandatory thing. The reason why it is not a mandatory thing is because in a sperm sample, any which ways, you are putting the sperm sample in a centrifuge. And once the sample is taken out from the centrifuge, you're putting it in an incubator. Okay. Both these are sterile things. You don't really end up requiring to have a cold, a room which has absolutely zero VOCs and so much strict sterility, because the particulate VOC is going inside the sample. Okay. And the time of exposure of the sample is really negligible. In fact, if you go to any IVF center in India, okay, most of the places you will find that andrology rooms or andrology laboratories, which we may call as a sperm processing laboratories, are not highly sterile. Okay, and they are accommodated in small compact spaces in order to save the space, especially in a city like Bombay. Okay, where space is one of the biggest problems.
Yeah. So IUI room, you didn't show your IUI room where you do
the ultrasound room. Yeah, the ultrasound room is the place where we do the IUIs. Doing an IUI, as I mentioned, doesn't really require any gadgets. Okay, it requires a Cusco speculum. And if in case you are not very normally comfortable, you can have stirrups. Okay, so that you can mount the legs. But apart from that, it doesn't really require a separate room. Okay, it doesn't really require that.
And the media and all those things you store only, you have a cold room because of
I have a cold room, but as I mentioned, if you don't have it, it is better to have a refrigeration facility, which is going to keep a temperature between 2 to 8.
So the medical refrigeration is only the one which will keep it between 2 to 8 strictly. So if that is also not doable for many tier 2, tier 3 cities. So
then you can use the normal fridge and you can store it in the compartment. So when you open the door, don't store it on the door. From there, the loss of the temperature is the highest. Okay. Store it on the second compartment of the fridge or the third compartment of the fridge. From there, the loss of temperature is the least. Okay. But this is a very, I mean, we are on a live platform, and definitely this is a recommendation only if you don't have a medical refrigeration facility available. Okay.
Yes. So medical refrigerator, I think now it costs about anywhere between 60 to 80,000 rupees. So if
Yeah.
people have good volumes in their IUIs or IVF, I think they should.
I want to mention one point here. You first invest, volumes will come on its own.
Yeah,
Don't worry for the volume to come and then invest. First invest, automatically volumes will come because the results will start coming with good investments.
yeah. See, as you said, infertility is a result-oriented field, wherein even though the capital investment is intense, but the outcomes also depend on the amount of capital that you invest in the machinery, in the infrastructure, in various other things. I think,
Absolutely.
yeah, I think as you said, first invest and then prove yourself, prove your results, and automatically the work improves. Coming to the media, like you said, you store the media in the cold room. You take out the media, put it in the heating chamber for 10-15 minutes before the IUI processing. Usually, what is your
So
protocol?
we normally, I had mentioned this even in my IUI lecture, that we calibrate the media inside the incubator. Okay, mandatorily. Okay, so we don't just take it out 15 to 20 minutes prior to a procedure. It will stay at least for 3 to 5 hours inside an incubator prior to it getting used. So it is going to be at 37 degrees, calibrated under CO2. Okay, and it is only then that we end up using the media for any purposes.
So you do both endoscopy and infertility work, both in good volumes. So you think your endoscopy work is giving you more of fertility work, or it is vice versa, wherein you are good in fertility and you have good outcomes. So your endoscopy work is increasing because of that, or it's
It
more.
is very difficult to predict because the type of endoscopy work which I get is something which is very high end. And simultaneously, the type of IUI work or an IVF or a fertility work which I get is also something which is very different, you know. So I personally don't think so.
Yeah.
But yes, your work will increase. If any one modality starts doing well, the other modality has to do well because they are very, very interconnected to each other.
Yes. So coming to CASA that you have, I know you have a
Yeah,
high CASA machine which costs around 20 lakhs, but the basic is
29 lakhs.
29 lakhs. So the basic ones which are available for 1.5 lakhs, which they say or they think that they are good enough as a standardized reporting. Do you recommend that, like for people who don't have trained andrologists?
See, ultimately, it is important to understand that in CASA, apart from doing a basic semen analysis, okay, a basic semen analysis is reported by the software in CASA. Okay, but for everything else which you have to do on CASA, for example, morphology, for example, DNA fragmentation, for example, any HOS test, okay, let's just assume for anything else which you need to do slide preparation. Okay, and this slide preparation and correct use of the kit is completely driven by the technician. Okay, if your technician has done it correctly, only then the machine will interpret it correctly automatically. The machine doesn't make the slide for you. Okay, and that is something which is important. So when you in fact, when you have CASA, you need the best technician available. It is exactly the reverse. Okay, and so I bought this little high-end machine because of the type of work which I was having or I am having, and I have it since the last four I think 5 years, almost 4.5 years at least, and it's doing very good. So we are happy with it.
Yeah, so you have this microscope. I mean, just to add a few points on the microscope. So you have 10x, 20x, 40x, and 100x magnification in that. So what
Yeah.
do you do with the 10x and 20x and 40x? If you can just elaborate a little.
Yeah. So see, in a Makeler chamber, most of your work will finish between 10x and 20x. Okay. This 40x and 100x. So 100x is predominantly going to be reserved if you are doing a non-CASA morphological evaluation of the sperm. Okay, even that is done on slide preparation, to be honest with you. Okay, 40x is something which you may just add on to add some more value to your semen analysis in patients of oligospermia especially. But apart from that, 40x is something which is not very commonly used on the stereozoom for routine andrology purposes. It is either 10x or 20x. Okay, beyond this, in that room you are not going to do much because even the loading of the tube, I mean loading of the IUI sample aliquot is going to happen in the IUI room. We really don't do it under a laminar airflow. Okay, but but it is a very, very good thing to have a stereo zoom, as I have mentioned, in your laminar airflow. Even if it is for andrology, it will really add value to your practice. That 20,000 rupees will add value, trust me.
Yeah. Do you, I know, I mean, you do a lot of IVF work, but I'm talking only about people who have only IUI till IUI setups and
Yeah,
don't want to invest on the IVF setup. So
correct.
in these kind of facilities, if they want to have a cryocan, if they want to store the semen samples, one, yes, I mean, they have to take permission from the
Level 2,
ANT. Level two
correct.
permissions are required. But I know you do the third frozen samples IUI
A
also
lot.
a lot.
Yeah,
Yeah. So I mean, do you recommend this as an add-on or from the beginning of the clinic or once they build their practice or the kind of like,
absolutely. Absolutely. See, the cost of a cryocan is less than 80,000 rupees. In fact, if you go for a small size cryocan and if you are doing only IUI practice, you don't really require a large can. You require a small can to store approximately 100 sperm samples at a given point in time, right? And that is not going to cost you, in fact, more than 50,000 rupees.
yeah,
Okay, that small cryocans. On top of it, the cost of putting liquid nitrogen on a monthly basis is going to be less than 5,000 rupees. Correct?
2,000 around, yeah.
Yeah, so less than 5,000, basically, correct? Irrespective of your logistics. In this entire situation, it's a no-brainer. I mean, that is the reason why I mentioned 10 lakhs, because 10 lakhs is on that higher side of investment which you need for a comprehensive IUI setup. And when you invest that 10 lakh rupees, see, I don't know how much normally people charge, okay, for an IUI. I have never inquired, okay. But on an average, if you look at my type of charges for an IUI, it is going to go anywhere between 30,000 rupees to 75,000 rupees for an IUI, depending on sperms are the same, but depending on what type of IUI we are trying to do and what type of client it is. So the recovery of that investment is 2 days, because you will end up doing, let's say, 5 IUIs in a day, or let's say 5 IUIs in a month, let's assume. Okay, so you will end up recovering everything in 1 to 2 months. Okay,
That is
it's
for your
not really.
that is for your high-end work that you're doing, like where they come with 3 IUI failures or no rupture or low dose HCG protocol with a very low AMH and all those things. So for 75,000, many tier 2, tier 3 cities are doing IVFs. So we can't really compare the costing.
We
What,
can't. No, we can't. But I think in 2 to 3 months, usually the
yes.
investment would come out. Okay.
Yeah. Yeah. So I think infertility is one branch, I think, which is now picking up because of the number of patients who are coming with fertility issues for various reasons. Could be lifestyle, could be like, other things also. And like compared to what it was before, which was majority of the times it used to be an obstetric practice. But now infertility is picking up. So to improve your obstetric practice, because government hospitals has taken over many of the obstetric practices in tier 2, tier 3 cities, and our private practitioners want to, improve their obstetric practice along with infertility work. So I think what you mentioned about the IUI, I think it's quite informative and good for all the consultants to give it a thought as to how they want to improvise, because majority of the results are, I think, dependent, as you said, on the machinery and the media and all the other things. So anything else you want to add on, like any particular?
I just want to tell to anybody who is listening to this is that, see, when any time a law comes in a country, it is a very good thing for the country, right? So when people get fear that because the law has come, I don't want to do fertility practice, it should be the exact opposite. Because the law has come, you should jump into doing the fertility practice, because now you know that if you do the right thing, you are 100% going to be protected, right? The law is to only penalize when you are going wrong. The law is to support you when you are right. That is why it is a law, right? And many a times when people message me stating that, I want to start, but I'm worried about what will happen with this level 1 and level 2 and all these things. And these guys are stalwarts. I mean, these guys have 50 crore rupees in their bank account, 5,000 carpet plots in the center of a town, in the center of a city, and they are worried, right? And I personally think they should not be worried, because they will do very well in life. And I think so. Okay.
just one other thing.
Yeah.
Can you just add a little bit on see this turnkey kind of companies who come and say that we are going to set up the complete IUI lab for you? Or I
Yeah.
mean, I have had enough and more people approaching me from the pharma saying that we will do the entire IUI lab setup for you, but I already have. So in these kind of situations, so the quality obviously, I mean, might be compromised when it is like, I mean, some established companies like say Intermedics or Shivani or Shine Life or somebody who will come and say that we will put up the entire IUI lab setup for 5 lakhs. So you would still be okay to recommend a turnkey projects, or you think that everybody should handpick their each one like LAF or even microzone?
See, one, people don't have that much time to handpick it. Second, they don't have that much knowledge, yeah, or even that much time of interest, to get into it. So I mean, see, it is very individual, right? As a traveling embryologist, I used to repair laminar airflows. So I know what used to happen inside and what goes and how it is cleaned and all these things. But practicing gynacs, I think it is very difficult for them to do that. Okay. One must remember that in today's time and age, if a company wants to come and set up your entire IUI lab or something like that, please understand it is their reputation also which is dependent on it. Okay. It is not just your reputation. Okay. They will not do any work which is nonsensical, because nobody in India or anywhere on earth just takes quotation and briefing from one company. They will at least take it from 3, and then irrespective of the specifications, they will ask their friend, Tere ko kya lagta hai? What do you think? And what that friend says is going to be something which will influence them the highest. Okay. But I am a firm believer of somebody who sets it up completely, because it economizes the entire project for you. If they are earning less money from laminar airflow, they might compensate on the liquid nitrogen canister. Let's just put it that way. But ultimately, your package will be good, is what I think. Okay.
Okay. So the last one, I mean, what takes to maintain an IUI lab?
The first thing what it takes to maintain an IUI lab is to do only indicated IUIs. See, you will end up getting very good results when you do indicated IUIs. Okay. You will not really end up getting fantastic results when you do unindicated IUIs. TK, we will do IUI also. Understanding. If your results go down in IUI, no, it is the most basic thing. Look, IUI people are the quickest to lose. Okay. Because if they've done 3 IUI cycles with you or 4 IUI cycles with you, and if they are not pregnant, then they may feel that they want a change of hand. Then if you are recommending IVF, they'll say, "Arey yaar, we failed 4 times here, we'll go to a different IVF clinic now." Okay. So this is the set of people who, if you get them pregnant, the amount of word of mouth referrals is 1:1,000. Okay. But to get that 1:1,000, you need to do indicated IUIs. Okay. That patient should know that he or she has an indication to doing IUI. The minute they realize that, no, and the minute out of that 110 become pregnant. Okay. After 6 months, once they reach 24 weeks, your practice would have doubled.
Yeah.
Okay. And I think that at least that is working for me. All right. Now I don't know right or wrong.
So
And
nice
that is working for me.
Sorry to bring a guideline. Nice guidelines say that eventually the IUI will not have a role in treatment of fertility. It may be only IVF. So, but I know that you still believe in doing a lot of IUIs, and you do a 3-digit number in IUIs. So you think in a developing country like India, so IUI still has got a lot of potential for the gynecs to invest on their finances, their time, their effort and energy.
Where are these nice guidelines made? I mean, I don't know exactly, but who makes them? Just for me to know.
Even I don't know. I just thought this is interesting.
So I think no problem. I mean,
No.
first of all,
Let's
I
not
don't know
talk
the
about
source.
like the guideline. I just want your opinion about what can happen. Like, if we promote IUIs in our kind of.
If you look at the per capita of India, okay, till the per capita of India, rural and urban both, it crosses $4,500. All right. which means till India becomes a 6.5 trillion economy. Let's just put it that way. Okay. Till that time, all right, IUI is going to be your primary method in fertility practice. Just remember that. So even if I go by the normal statistical average, non-political, of when India will become a 7 trillion economy, it's approximately 2037. Just going by economics, pure economics. Okay. If we are, let's say we do everything nice and we are achieving that 2034, we still have a window of 10 years.
Yeah.
Okay. And I am very confident that in a lot of maybe tier 2 and tier 3 cities, I was speaking to someone who said they are doing the entire IUI at 10,000 rupees, including medicines. Okay. So I'm sure they must be doing it, right? I'm sure they must be doing it. Recently, I was in Pune and I read a hoarding IUI at 1499. It is bang opposite Surya Hospital, that hoarding. I don't know which company it was, but it was a hoarding of
In some
IUI at
in some places, IUIs are done in camps free of cost, and if they don't conceive, they are given an offer for IVF. So let's
could
not
be.
talk about these
No,
practices.
could be. So what I mean is it is a very cost-effective approach. And when you do it correctly, you are 100% giving that patient around 10 to 12% success rate per cycle. Okay. And if people do become pregnant, your practice will increase. Forget the IUI, your practice will go up.
Yes. I think the point to be driven is like once the success rate starts picking up for you, definitely the practice will pick up from every aspect. Like you get more endoscopy work, you get more obstetric work, you get more gynae work because of your good fertility results. So thank you, sir. Thank you very much. I think it was quite an interesting session. Thank you, for which I didn't have to study today. Thank you very much.
Thank you, madam.